Students with emotional and behavior disorders encompasses our Chapter 7. So we always start out with the Individual with Disabilities Education Act definition because that is the definition that defines the population. It's how we categorize these groups of students. So what do we know about this group? Well, they have one or more of the following characteristics. Now, what's important is the characteristics have to occur over a long period of time. What's a long period of time? Generally, we say about 6 months. And the characteristics have to be to a marked degree, meaning that they have to be elevated. And they have to, just like every other disability, they have to adversely affect the child's education. So what are these characteristics? Well, it's an inability to learn that can't be explained by other things. An inability to build or maintain relationships with peers and adults. Inappropriate types of behavior or expression of feelings. Pervasive mood of unhappiness or depression. Physical symptoms or fears associated with personal and school problems. So you should note that these are children that the predominant feature is one of behavior. However, we do get from other organizations that really work with these children some other definitions as well. So the National Coalition on Mental Health and Special Education says that it's a disability characterized by, again, behavioral or emotional responses that are so different from age-appropriate, cultural, or ethnic norms that they adversely affect educational performance to include academics, social, vocational, and personal skills. So here you see this definition also addresses us to the fact that the characteristics are not appropriate for one's age, chronological age, that they are different from the culture in where the child resides and are within the ethnic group that the child's from. Additionally, they say that the characteristics are more than a temporary expected response to a stressful event. So, for example, a child going through divorce might experience depression for a period of time, but may be able to overcome that. So that might be a temporary thing. Consistently exhibited in 2 different settings, one of which is school. So to receive special ed, certainly the characteristics of the child have to be exhibited in the school setting. They're unresponsive to direct intervention in general education. They can coexist with other disabilities, so a child can have emotional disturbance as well as, say, for example, learning disability. And they also may have a mental health diagnosis such as schizophrenia, affective disorder, anxiety disorder, or conduct disorder. So the label, the educational label, is emotional disturbance, but the child may have a mental health label as well. What are the numbers of children with emotional and behavior disorders? Well, it's the 5th largest disability category served under the Individuals with Disabilities Education Act. About 7.5% of all students in this category receive special education. African American students are overrepresented in this category, so we have to be careful about that, about categorizing too many children from other races and ethnic groups, and really take a consideration as to why this is happening. There are far more males than females identified as having emotional and behavior disorders. Again, we need to be careful about overrepresentation of gender as well as race. The factors that may contribute to emotional behavior disorders are certainly, again, just like every other disability, we have biological factors. We see heredity factors, brain injury, both pre and post-birth, nutrition, accident or illnesses, psychosocial, chronic trauma or stress in the home, stressful life events, childhood maltreatment such as physical, sexual, emotional abuse, and other family factors such as poverty play a part. What are the behavioral characteristics of children with emotional behavior disorders? Well, there are 2 types. One is internalizing behaviors. The other is externalizing behaviors. And that doesn't mean that the child couldn't have both. But a lot of times we'll see a child that might have one or the other, and we know that females are more likely than males to exhibit internalizing behaviors and actually be overlooked because of that. So what does that mean? They might withdraw, be extremely quiet, be depressed. Externalizing behaviors are easy to know because they're the external ones. They're aggressive, either verbal or physical aggression, acting out. What are the emotional and social characteristics of these children? Some exhibit extreme fears. I have worked with children who were extremely afraid of going to school or walking out their door. Anger, aggression towards peers as well as adults. Low self-esteem, so that's more of an internalizing behavior. Very, very low self-esteem, a learned helplessness. Depression, again, an internalized behavior. Problems with relating to people, so problems with social relationships. And they actually may need to be taught social skills. When we talk about cognitive and academic characteristics, many of these children have low average to average cognitive ability. So they could be average, but because of the behavior problems so much impacting school, they have difficulties with academics. So significant academic difficulties, and they are at a very high risk for dropping out. Just like any other disability, we have to ask the question does their emotional and behavior disorders cause academic problems, impact educational performance? How do we assess these children? Well, a lot of them will be assessed using rating scales, using behavior scales, so scales for assessing emotional disturbance, behavior assessments, behavior rating profiles, and certainly our testing in the area of cognition and achievement. So we have classroom assessments that the teacher will do, both behavior rating as well as academic in nature. And we also have counselors involved, social workers, psychologists who will take family and developmental histories. We have medical information we might need because many of these children are on medications, as well as strength-based. What are the strengths of the family and the child? To be eligible for services, we have to consider the emotional disturbance characteristics included one or more found in the federal definition. We have to look at characteristics that adversely affect educational performance, and we have to really take a look at whether or not it's a social maladjustment problem, okay? We cannot label a child with emotional disturbance if there's only a social maladjustment problem, okay? But if we have these, we consider the child eligible for services for special education. In early childhood, there are some risk factors. So we have to educate parents about the effects of their behavior. We have to teach parenting skills. We have to provide for early intervention, so using praise and feedback, increasing student engagement in classrooms, fostering collaboration between professionals and families, and nurturing homeschool communication, as well as establishing clear classroom rules and structure. 37.3% of students are in general education in the elementary and secondary education programs. However, this is the population who are along the least restrictive environment, or LRE continuum, are in most of the self-contained classes as well as in separate schools. What are the concerns? Well, certainly there's a concern about expectations in the general education classroom, and about social skills or anger management program, training, social rejection, and lack of mental health treatment options for these children. Inclusion can work, though. We know that that we have to teach teachers how to deal with behaviors. We have to have support for the general education classroom, strong administrative support, a behavior intervention plan, an academic plan, and again, skills for teachers. We are concerned about this population because there's a very, very high dropout rate of this population. They have problems potentially finding and keeping jobs. We have to be concerned with improved outcomes for families. So providing community support, family-centered practices, better access to mental health, teaching skills that will help the child after high school, and focusing on transition. The recommended practices for these children, definitely early intervention services, school-wide positive behavior support plans, as well as individual plans when the child needs it. Effective interagency collaboration. What does that mean? Well, it means collaboration with the school, the mental health organizations, as well as hospitals, doctors, and the family. Wraparound services, meaning having therapeutic support staffs directly in the school and behavioral consultants. Making sure that we're continuing to assess in the area of behavior using such things as functional behavioral assessments and providing behavior intervention plans individually as needed for the child. Effective classroom interventions we found to have peer tutoring as well as peer-mediated instruction, cooperative learning, and teacher-led instruction. All of these can be effective. However, we have to be very careful when we are pairing up children with emotional disturbance with other children. Parent and family perspectives. Generally, we're seeing more children coming from low-income and single-parent families with this diagnosis, so we have to really understand the barriers and the stress that these families go through. Parents may have had negative interactions with schools for themselves, and we have to be sensitive to that. And little advocacy exists for these families, so we have to be strong advocates for the children we serve. We have to build positive relationships with families and generally care for the child and strive for the strong partnerships, providing parent-centered parent education, and facilitating formation of parent support groups. Now, this sounds easier said than done, but pretty much as a teacher, what you can do is make sure that you understand how to best communicate with the family and make sure you're communicating. What are the trends and issues with this population? Well, many youth who need services remain unidentified. So even though they're the 5th largest category, we still have many youth who are unidentified. Legislation is needed to strengthen and expand services for students and families. We need better access to services through the healthcare system as well as the mental health care system, and better professional development to include teachers. We have to make sure we understand the laws in our state around restraining children. This is the population who is most at risk for being restrained and being confined. So what are the laws? Should we even ever be putting our hands on a child? So we need to understand that as teachers. And that takes us through Chapter 7.